we're going to just try to focus on the very narrow and simplistic use of the StreetLight data that we undertook, and recognize that there's a lot more that could be done both with the platform and with this topic area to sort of enrich our understanding of access by non-auto modes and the utilization of those modes and how we can better plan for accessibility going forward. I want to give a little bit of background, just cover some of our kind of project scope and key questions, but I'm going to skip over a lot of the bulk of the work that we spent time on during this process and go right to the insight stuff, but we'll kind of get to see how it relates to the results and what that means in terms of some of the next steps. Our lessons learned are probably going to be a little underwhelming because it's going to be stuff where it's like, well, we probably should have made a little bit heavier duty use of some of the things that StreetLight can offer in hindsight. But that was just because we were really focused in the early going on some of the methodological stuff that won't be the emphasis of the talk today. The city of Richmond has really been focusing in the last several years on changing its entire sort of policy regime to focus on equity and to acknowledge and respond to and ameliorate inequities that have been, established through historical practices like redlining and highway building and urban renewal, and just recognizing that there's institutional biases within the city and among partner agencies to some extent that have created some really clear issues of inequality with respect to who is well served by the transportation system. And they really wanted to understand sort of the limitations in terms of accessibility for different residents and what that would mean, not just in terms of their use of the transportation system, but how that relates to other outcomes, which I'll get to towards the end of the presentation. So this was work for OIP through the Growth and Accessibility Technical Assistance Program, which is designed to help localities basically just do better planning, integrate the concepts of accessibility into their local plans, as well as establish some methodologies that may be transferable to other parts of the state. I'm sure people are familiar with it, but our primary focus was on the applicants, which is the city of Richmond, use of this methodology, both in terms of understanding sort of the landscape of access and equity across the city today, as well as leveraging that for some forthcoming work that we're actually now underway with to do some local transportation planning in the city. It stands to reason that the emergence of equity as a key policy direction requires us to think through what we know about it and how we measure it. So we wanted to make those connections as part of this process and again, prepare for the Richmond Connects Master Plan. Within that sort of broader framework, there was a lot of emphasis placed on really dialing in our multimodal accessibility measures to make them more nimble and responsive to traveler characteristics. And so for the most part, we really spent the bulk of the project sort of focusing on how did this sort of intersection of income and education and household size and sex and age and work status and all these kinds of things really influence the types of trips that people need to be are making and what that means in terms of the destinations that they would need to have access to on a daily basis. And that took the bulk of our energy. Then we wanted to understand, okay, well, where do we see high and low spots? What are the maybe causes and impacts of low accessibility, and understand who is underserved by the current system. So again, I'm sort of just waving my hands and saying we did all that. And we came up with some scores about sort of where there was high and low access. And actually, there's a lot of different permutations of those scores that provide some different insights that we don't have time to go over today. But what we wanted to be able to do was to compare our understanding of where access is provided and how that relates to utilization, primarily to understand, are there barriers to access, but it actually sort of helped highlight some other issues about the nature of dependency on non-auto modes and the design of the system to really be totally car-centric and where that leaves our underserved and underprivileged populations. So we went to StreetLight for our mode utilization analysis, just because it was really the most convenient and richest data source available to us. The primary alternative, might have been just defaulting back to some ACS journey to work information, but obviously there's some high margins of error as you get down to the local level. And it only focuses on the work commute in the first place. And we wanted this to be a more holistic sense of the kinds of trips that people are making, their experience of access to a broad set of destinations. So it's not just limited to access to jobs. So the StreetLight data enabled us to consider that mode utilization for all trip purposes and give us a more holistic analysis to start from. We wanted to sort of say, where do we think mode utilization is high relative to accessibility provided by that mode? Where is it low? But that was the kind of a qualitative judgment in that space. We didn't really have bandwidth or schedule within the project to do anything, fully calibrated from a modeling standpoint to try to tease out some of those kinds of details. So our general assumption was that we should expect utilization of a non-auto mode to be high where the access is also high, and that's a pretty intuitive finding. And we've actually done some work in this area and in other contexts to kind of explore the relationship between modal accessibility and mode utilization, and there's certainly a correlation there. What we did is just compare each zone's utilization percentile score to its access percentile score. And if we had major differences, then that would help us kind of highlight, okay, well, this is an anomaly. It's higher than expected or lower than expected. So if some place had a walk access score that was in the 85th percentile, but its mode utilization for the walk mode was maybe in the 40th percentile, there's something at play there that would help us or cause us to think they really should be higher than what we're seeing in terms of that overall utilization. So where is it higher than expected? Where is it lower than expected? We'll just kind of quickly go through some of those results. Walk use relative to walk access is shown on this map. And we just, again, categorize generally expected, more than expected, less than expected. The areas where we see less utilization than expected do exhibit some kind of relationship to the commonly cited barriers to utilization. So you may have some permeability across the James River or across through underpasses or overpasses over highways. But really, those barriers are more substantial psychologically than the routing engine might indicate. And so we do see shadows of freeways and rivers indicating where walk utilization is lower than we would expect given the modeled access in those places. It's a little bit hard to see on this map because we don't have the freeways necessarily superimposed, but the I-95, I-64 freeway around downtown it is kind of leaving some of these shadows to the north. And then to the west, this is, I'm going to blank on the name, but there's another limited access highway here. And then the James River kind of on the south side of the river there. There are some places where some steep grades may also factor into underutilization. For the bike mode, we actually generally kind of saw that there was a little bit weaker correlation. We have a lot of this more than expected type of area, but we'll focus on that in a little bit more detail later on. Where we saw less than expected utilization, primarily a little bit of highway barriers, but also just places where walking is potentially just too convenient. So that sort of blue area in the downtown, we might see lower than expected bike utilization because travelers in those areas are not seeing the benefit of biking. All the destinations are really proximate. You can walk to them. There's no really real point in dealing with bike parking and storage and that sort of thing. Transit utilization, the indications of less than expected utilization, again, sort of that sense that you have a lot of access downtown, but walking is really too convenient to use the transit mode as much as it might indicate. And then we have some areas where there's some poor access, egress, or waiting experiences, although there's a lot of variability, so not all the same characteristics have the same utilization issues. We did notice that there's a lot of intervening suburbs that have this higher than expected utilization, and access there is inhibited by low density development patterns, but the use is kind of strong due to some socioeconomic and demographic characteristics, so mouthful, in many of those neighborhoods. And that's what we're going to kind of take a look at next. In many of these cases, we're looking at households where non-auto modes are utilized more out of necessity than by choice. And so that more than expected designation prompted us to explore the characteristics of the residents and their experiences of the system, as well as some particular outcomes that we'll cite here. So where we saw overutilization non-auto modes, the primary sort of barrier to access in this case may be that if you have a car, you're likely to use it in Richmond. Residents that don't have at least as high a rate of access to a personal vehicle have limited travel choices and tend to use or at least those neighborhoods tend to exhibit more multimodal travel, that higher than expected range. These are also sort of correlated with areas that have more overall health risks and greater incidence of chronic illness, lower participation in the healthcare system. less access and utilization of technologies, tend to be unbanked, tend to be less able to replace trip making through virtual accessibility. So for things like remote work or a session like today, or online retail, so on and so forth, these users are less likely to participate in those systems. And we saw as well that there's some, when things like a pandemic disrupt your ability to get to places by non-auto modes, that can have inequitable impacts when people are dependent on those modes. No surprise that the demographics in these areas kind of correspond to what's typically our kind of set of communities of concern when we're thinking about environmental justice and equity analyses. So definitely higher concentrations of people of color, low-income households, people who, for whatever reason, are not working, maybe not part of the workforce or struggling to find employment, persons with disabilities and with lower levels of educational attainment. And these places are also generally, although not consistently, facing higher risks of gentrification that could be partially fueled by investments that enhance accessibility. We don't have time to really explore that today. We did a lot of plotting of kind of averages across the city. So how is the city performing overall in terms of access to different destination sets? People of color versus the white population. We can see that the bars below the horizontal axis here indicate that access citywide is lower. There's a bunch of different permutations of the scores that I don't have time to kind of explain what we mean by competitive and non-competitive, but for the most part, you can see people of color face, they have less access than the white population generally across the city. There's some exceptions for certain modes and certain destination types, but that's a prevailing kind of tendency across the city. The same thing is true, and actually even maybe more so, for the Hispanic versus non-Hispanic set of comparisons. When we look at income, it's a little bit more evenly matched. And when we look at, I have another plot for vehicular ownership, but it's more along the lines of income where it's kind of similar. In the interest of time, I'm just going to kind of talk through next steps. These findings were obviously really important for us because we wanted to kind of have a holistic understanding of where things stood in the city. There's the sort of anecdotal engagement side of this story, and then there's the quantitative side that we wanted to tell. And this would lead us into what we are planning to do next for Richmond Connects, which is the city's multimodal master plan. We want to apply these accessibility measures to really highlight where quality of service, connectivity, safety, and other factors impede access to destinations, especially for vulnerable communities. There's some policy language that's been developed in parallel to the technical methodologies that we developed at this time that help really kind of make that analysis need very concrete and very specific. So we're trying to dial in the technical methods to suit the policy language and really reveal where the city needs to make some investments. And those accessibility scoring tools have also been transferred to OIPI or OIP for potential use in applications across the state. We'll see if there's adoption of any of those. StreetLight was the simplest and most comprehensive solution for estimating our non-auto utilization. And I think it's a really great resource that OIP has made available, or VDOT has made available for use across the state. And I'm sure that all of you have benefited from that. In hindsight, there was a lot that we probably could have done to dial in a little bit more about some traveler characteristics and utilization of modes before we ran out of time. So we do have an interest in exploring some follow-up, explorations of the data available through the platform or additions to the platform.